My name is Frederick Boop, but I go by Rick, and I'm the current president of the American Association of Neurological Surgeons. I work in Memphis, Tennessee, chairman of the University of Tennessee Health Science Center, and work for a group called Sims Murphy Clinic. I'm very honored to present at this year's EANS meeting on some new developments in pediatric neurosurgery. When we think about our current techniques for mapping the brain, a lot of it is done with patients awake under local anesthesia, which is not an option with children. And we have some new techniques where we can determine where the speech area of the brain is, or the visual area, or the movement areas in children down to 1 year of age while they're sedated under anesthesia with functional MRI, magnetoencephalography, transcranial magnetic stimulation. And we'll talk about how we can do surgery more safely in children by identifying those areas. It's a tremendous honor to be invited to the EANS meeting, and I'm very appreciative of the leadership asking me to come. It's a small world these days, and between social media and the internet, we now have chat rooms. Our educational tools are much more similar. So the opportunity to have some FaceTime with leadership is a tremendous opportunity for us to share our knowledge and for us to advance the field together. The EANS, first of all, is a lot of different countries coming together, whereas in the United States we have a number of states coming together. So a lot of times the governmental issues or training issues or work restriction issues vary from country to country, and it's a tremendous opportunity for us to learn from our partners in Europe how we might do better in our own society in the United States. We have lots of collaborations nowadays. Starting about 2.5 years ago, the AANS started inviting the presidents of the 5 continental societies to attend our board meeting. And so now they come as our guests to our meeting every year, but they also present at our board meeting what's going on within their societies. So there's a lot more information exchange now. We come to their meetings, we have an opportunity to tell them what the AANS is doing and what our new initiatives are, what new exciting developments have taken place in our country over the last year. So I think it's a tremendous opportunity to collaborate as groups, and we all work together under the umbrella of the World Federation of Neurological Surgeons, which is where all the societies come together. Next year's meeting of that AANS is in Los Angeles, April 22nd through 25th. And our partner societies for that meeting are the Australasian Society and the EANS. So we're looking forward to inviting a large contingency of international guests to our meeting. We'll have a pre-meeting meeting with some of the finest neurosurgeons in the world speaking on various topics. And then we'll have 2 international symposia starting the days before the meeting. For the AANS meeting in Los Angeles, the theme is a world of innovation. And so global perspective, things that are happening new in the world, particularly focusing on education. In the last year or two, there has been a tremendous interest in increasing access to neurosurgeons globally, trying to increase the number of trainees, the number of training centers, and I think the whole world is focused on how we can best do that. The year passes quickly as president, and the idea is to push this global theme. It's a small world now, and with the internet, with other opportunities, we're getting to the point where we have online educational tools that can allow a neurosurgeon anywhere in the world who has a smartphone to get on his smartphone and see how to do a surgery, see edited videos of how to do an operation. And so regardless of whether he's got a library full of textbooks, he can sit at home the night before an operation and see how people in other countries might do that.